This is going to be a very bizarre comment I'm about to make, but the comment is, and it's got to be taken. And you got to take it in the attitude that I'm presenting it in right now. It's this. No one ever jumps for joy. Ooh, I got cancer! Yay, boy, are we going to have a good time? Hello, that ain't going to happen. But if you try to make good of a bad thing, how do you take a lemon and turn it into lemonade as best as you possibly can? And if working on treatment to help the individual, but this could also be a good time where you could even say to people, this might be a time when maybe you want to live out a little fantasy. You always wanted to be a blonde. You always wanted to be a redhead. Maybe you can go ahead and do that. Takes your mind off of what's happening, make you feel a little bit better about yourself, and have a good time. I don't know. But it's a thought.
That's the concept. It is the concept. You want to feel better about yourself at that certain stage of your life. And why not? Why not? If there's a fantasy that you've always wanted to try, why not do it?
Absolutely.
Why not have a different look?
So tell me now, educate me. There are lots of different wigs that people can get. Educate us right now.
Yes, there are different types of wigs. There are synthetic hair wigs, and there are also human hair wigs.
Look at me.
Okay. And, right, sorry.
Yeah.
There are wigs that are in the budget range. There's a mid-price wig, and there's a high-price wig.
But what's the difference? What's the difference?
The difference. Well, the budget wigs I don't really recommend because they look that way and they look wiggy.
Look cheap.
Right. They look wiggy. They don't look natural.
Wiggy.
I want a wig that when someone goes out, someone's going to say to them, even if it's a different look, oh, you just had your hair cut differently,
good.
or you had your hair straightened.
Right.
You look fabulous. It literally looks great on you. The high-end wigs take too much maintenance and they take a long time to make, because they usually sew them in like 4 or 5 hairs at a time.
Whoa.
So it could take 4 or 5 weeks to make a wig custom made.
Those
like
big high-end wigs, are they real hair?
Yes, they are real hair.
Real hair.
Yeah,
Now, but actually, the real hair wigs are good for the alopecia patients.
Use the alopecia. Tell everyone what alopecia is.
It's a disease that someone contracts when they're younger and they just lose all the hair.
Has nothing to do with cancer.
No, it has nothing to do with
Okay,
cancer.
just want people
so these are
to
the
understand
people that would use a real hair wig because it's something they're wearing all the time, not just for 3 to 4 months. So there are
People don't sleep in these wigs, do they?
no.
Okay.
I mean, you could if you
You
wanted
could,
to.
you could. Would you ever advise it, or there's a negative to doing that? It kind of pulls on the hair or something like that.
Well, there's not a negativity, but as far as comfort goes, like when my wife had cancer, in the house she would just wear these new fashion looks with a scarf on her head, which a lot of young people wear, because it was more comfortable in the house. When we went out, she'd put her wig on, and when she slept at night, she didn't want to sleep with a wig on. It wasn't really comfortable.
Right.
If you're in the summertime, you could just sleep, with nothing on. But if you wintertime, actually hair keeps you warm.
Right.
So
Yes.
if you lose your hair in the wintertime
Yeah.
when you're sleeping at night, you'll actually have to put like a wool hat or something on to keep warm.
Yeah. Lately, I've been feeling pretty cold in the head. So.
And I'm always hot.
Yeah. Look at you. My God. I could paint my house with your head. Unbelievable. It's terrific. Okay, a question that I've always had about. Did you want to add something?
Well, I did want to
Yeah,
add
go
something.
ahead.
As far as, we were talking about the different types of wigs. And what I was
Please.
going to say is the type of wig that I really suggest for most cancer patients is a mid-price wig,
Yeah.
which is synthetic hair, not real hair, which actually are the wigs that are standing in front of you
These
right
are all
now.
synthetic.
These are
They
synthetic
look,
hair.
they look great.
Even if you touch them, it feels like real hair.
Yeah.
It looks like real hair.
Is that what this is?
That's all synthetic too.
These
Yes.
are beautiful. I mean, you can
Yeah.
feel these.
Yeah, absolutely. What is it made of? Nylon or something? I mean, what product is synthetic hair made of?
Yes,
Do you know?
it's made out of nylons and
is.
plastics, actually.
And how does it stay in the foundation that holds the hair together?
Well, it's
Glue or
no, it's
tie?
hand tied in. These are
kidding
hand
me.
tied in.
All these wigs, I mean,
Right.
you've got someone sitting there tying up all these things. You go bonkers after a while.
Well, that's their job.
That's their job.
That's their job.
Unbelievable.
Well, people sew material, so people sew hair.
Right. Wow, each little filament of hair gets put in. Well, that's some job. Okay, so now people. Here's the other thing also. Can you style a nylon wig or a synthetic wig like you can real hair? The property is the same as the synthetic and real hair, or it's from the factory? It's made that way. Like this over here got straight blonde hair. Can these can someone ever put this up in curlers and then make it curl?
Yes, you could.
You could.
Actually, it will take a setting. But the beauty of these over a real hair wig is a real hair wig has to be maintained by a professional. When you clean it, it has to be set or blow dried again.
Real hair.
Real
At
hair.
this point, you want to make life a little easier because you're going through a very stressful period. You know, so, for instance, this wig right here. Now, Stephen just pulled this out of the box, shook
It's ready
it,
to go.
and put a brush through it, and that's it. As a matter of fact, all of them just came out of the box and just put a brush through it, and it's ready to go. So this is the way it comes out. It's a nice product.
What I compare these to is almost like a wash and wear shirt that you would travel with. You can actually wash this wig yourself in a mild shampoo, let it dry, and just take it and shake it really hard and turn it upside down, and it goes right back into the style again.
Really?
Yeah.
Yes.
What do? You just let it hang out? You like maybe take a hanger or something and let it hang upside down in the
well,
shower? Or what?
You see these heads?
Yeah.
You could just lay this head on its side and just lay it over it. You don't put it on the head while it's wet because it can stretch out the base.
That's very, very interesting. So now, how do you help a client choose a wig?
Well, usually what we do is I bring a few samples along that we can look at,
Right.
and then I bring some catalogs with many, many pictures in them. First, we talk for a while. I see what their lifestyle is and what they're about. You know, I also like to talk about their disease too, so that, you know, everyone's comfortable. I believe in speaking about everything. And you know what I find? People open up to me, they want someone to talk to. You know,
Right.
to me, this is part of making them happy also, besides getting them a wig that's great for them, is to talk to them about what's going on with them and give them someone outside their own life to speak to. Maybe they have something to say that they wanted to speak to someone else about. So I talk about it. I tell them about my wife, and we kind of find a nice little medium together where we meet together.
What were you going to say?
Nothing.
Oh, you look like you were ready to say something like that. Is if you want to continue?
Yes.
Please.
So then we find this medium and what their lifestyle is about, and we decide if we're going to have a wig that's going to try to match their own hair, the original look, so they just look natural, or if they want something a little different, or maybe they want one that looks like their own hair and maybe one that's a little different or even a different color. Once we establish this, we pick the wig. I try to help them out a bit. Because of my expertise, I know that a hairstyle can bring out the good features in someone's face,
true.
or it can hide the bad features in
True.
someone's face.
Right.
The hair color can bring out someone's skin tone and eye color and enhance it and make it look beautiful. Where if you put the wrong color on, it can wash their face out
Right.
and make them not look beautiful. So I try to add a little of my expertise and sway them a little in the right direction if I think they're going wrong.
Especially at this time in their life.
Right.
Because they're just lost without a paddle. And you come along to give them a little direction and say, don't worry, I'm going to help you. When I'm done with you, you're going to look gorgeous. Look just G-A-W-J-U-S.
And they do. They
And
do look gorgeous. Compliments. Remember that wig that you delivered to?
No names.
No. The woman in the hospital on Mother's Day?
Yes,
On
that's true.
Mother's Day.
Yes.
Tell me the story.
Well, last year on Mother's Day, I had this wig delivered, and I was very busy, and I couldn't get to this woman, and she really wanted it badly. And she had called me up, and I called her on Sunday morning. It was Mother's Day. I said, you know what? It may be Mother's Day, but my wife understands since she went through this herself. And I don't live too far from the hospital. I'm going to come over there and deliver your wig to you so you can have it on Mother's Day and be happy. And she was actually one of my toughest customers, but when I came there that day, she was so happy and smiley, and you know, it turned her whole personality around. I really felt good in my own heart about, you know, what I did.
That was a good story.
That's great.
Yeah.
That's
It was a
great.
good stuff.
Let's get down to a little nuts and bolts. So someone's undergoing chemotherapy and they have their insurance taking care of everything for the treatments, et cetera. But what about the wigs? Does insurance ever cover this, or patients are on their own?
No, insurance will pick up, most of the time it will pick up 80% of it.
Really?
Yeah. Depending on your insurance,
Really?
but sometimes, most of the time it'll pick up 80%.
Wow. Do a lot of people know this, or you have to tell them this?
Well, they ask and we tell.
Well, even if, you know, if they don't mention it, I ask them, that's one of the questions I say to them, basically, what insurance company you're with, does your insurance cover it? And sometimes they know they've checked it out, and sometimes they haven't. If they haven't, I tell them to call their insurance company after and, you know, find out if they cover it.